So the PCOS we know is that is the endocrine disorder in reproductive age women. Is characterized by three things: hyperandrogenism, ovulatory dysfunction, and insulin resistance. I will put it up there. So what happened in PCOS is that they have problem. They have they are going to produce more of men's hormone. So the men's hormone will be high, hyper. Men's hormone will be high, hyperandrogenism. Okay. Then ovulatory dysfunction, then insulin resistant. Please remember that. So they have problem with their insulin. So that hyperandrogenism is just excessive androgen, which is male hormone. So that means they have a lot of male features as a woman, male hormone. So under the PCOS, they have the problem with ovulation. Always remember that they have problem with ovulation, and they also have problem with insulin. So insulin resistant. So very important. So always remember that the hormone problem increase androgen, increase luteinizing hormone ratio of follicle stimulating hormone. I will still show you what that means. And they have insulin resistant. Another thing is under menstruation, they may have oligomenorrhea or amenorrhea. They may have little to no menstruation, little to no, because sometimes they can stay up to like 6 months, 1 month, 1 year. They haven't even seen their period. Okay. Then they may have their skin issue. They may have a lot of hirsutism, which is excessive hair, hirsutism, acne, androgenic alopecia. Under metabolic, they are going to have weight gain, increased risks of type 2 diabetes. They will have dyslipidemia, so high lipids. So, how do we make diagnosis? How they make diagnosis is that the patient may start complaining that they are not seeing their period, maybe about 6 months, 1 year. So ovulatory dysfunction. They can also see a lot of polycystic ovaries on the ultrasound. A lot of polycystic ovaries on the ultrasound. But one thing I want you to remember that is really high yield is this um labs, okay, or what to look at. And I broke it down, I call it FP Latib. So FP Latib is just what to use to remember. So the FP Latib, your F is your follicle stimulating hormone. So just think about it, in normal people, this is going to be opposite with PCOS. In PCOS, their follicle stimulating hormone is going to be, like we said, is going to be normal or is going to be low. But in a healthy person without PCOS, is going to be high. The follicle stimulating hormone is what helps women to get pregnant, because the follicle stimulating hormone, if is that normal or low, is going to be producing poor follicle maturation. So they're going to find it hard to ovulate. That is a problem. They're going to find it hard to ovulate. Then their P P is progesterone. Progesterone in a normal lady supposed to be high, but in PCOS their progesterone is low. Is low. So because ovulation does not occur, so it's not normal. So that is why FP, I put the FP, which is follicle stimulating hormone, and progesterone. These are the ones that's supposed to be high. Just think about it. They are the one that's supposed to be high in a woman that is fertile, high, elevated, because you want your progesterone to be elevated, you want your follicle stimulating hormone to be elevated. That is what helps you to be able to ovulate and be able to produce children. But in PCOS, we say that they have problem with their ovulation, they have problem little or no menstruation. Remember, for a woman to get pregnant, these two cycles must occur: their menstruation and their ovulation. Those two cycles is a cycle, 28 days cycle. Okay, some people are little less or high, but we are not going into that. But that is a cycle. Okay, but in PCOS, it's either they are not ovulating or seeing their menses. They can go up to like 6 months, 1 year, and that is why we said is a problem. So the follicle stimulating hormone, which is F, progesterone, which is P, it is low, which is not normal. But the Latib is the one that is not good for a woman. Those ones will become high. So what do I mean? The ones that is not good, like luteinizing hormone. Luteinizing hormone is is what it will do. What luteinizing hormone? It will is what will inhibit, you know, production, ovulation. But in these women, their own is very high. So it will cause increased androgen production. Remember, all those male hormone. Another thing you see with PCOS, their androgen, again, which is a man's hormone, will be too much, excess. So you see that this Latib is not a good one, but that is what they have in excess. So they have that androgen. Because they have that androgen, they are producing a lot of male hormone. So they have a lot of acne, a lot of extra hair, hirsutism. Another thing is their testosterone. Testosterone, another hormone in male, is going to be high too. Then I is your T. Another T is triglyceride. Remember, they have issue with their lipids too. So their triglyceride will be high, making them at risk of heart disease. Their I is insulin. Their insulin will be high because they have insulin resistant. And B is blood pressure. Their blood pressure will be high too. And E is they are going to have elevated estradiol. So this elevated estradiol is high. It causes a continuous estrogen exposure. So always remember that. And all this chronic annual ovulation, they are not ovulating, it will lead to low progesterone, unopposed estrogen, and it makes them at risk of cancer. So people that have PCOS, you see that they are at risk of, let me bring it up, they are at risk of endometrial cancer. They are at risk of endometrial cancer. What type of cancer is there an increased risk of in PCOS? The answer is endometrial cancer. So please take note of that, because everything we said, these hormones are really exam favorites. So you have to know that what these hormones signifies and all that, because it helps you. So I'm just going to put it up just for emphasis to remember. Like we have said, they are going to have this hormone thing. Their FSH, follicle stimulating hormone, it is going to be normal or low. On in a normal lady is usually high, but their own is normal or low. So causing a poor follicle maturation. They are not able, the follicles are not able to mature, and their ovulation is going to be low. Their luteinizing hormone, their luteinizing hormone is elevated, so which increases androgen production. So always remember their luteinizing hormone to follicle stimulating hormone is increased. So this is a classic exam question. So it's not good. The follicle stimulating hormone is the one that's supposed to be high. I've said it so many times. So please always take note of that because it's very important. And also, these people are going to have a lot of reproductive issues. So, what are those reproductive issues? They are going to have irregular menses with or without menses. Sometimes they don't even have menses. Okay. Sometimes they don't even ovulate. So, they are going to have hyperandrogenism, androgen, androgenism. So they are going to have acne, hirsutism, androgenic alopecia. So under metabolic syndrome, this is all there. Insulin resistance, acanthosis nigricans, increased triglyceride, hypertension. Okay, hypertension. So why will pregnancy affected? This is the same thing I have said over and over again. The reason pregnancy is affected is because they have low, again, I have said this so many times, low follicle stimulating hormone is supposed to be high, but in PCOS, their own is low. So it's going to make the follicles not to mature. So they are going to have difficulty conceiving. Then they have a high luteinizing hormone plus androgen. So this is going to cause ovulation to be suppressed. So remember, they're having problem with ovulation, they're having problem with their menstruation, and they also have problem with their insulin resistance. Then low progesterone, the low progesterone will affect the luteal phase, it will cause the luteal phase destruction or dysfunction. Okay. So these are very, very important to remember with PCOS. Very important to remember. And like we said, what are the treatment? I go over the treatment. You can, I know this is, hold on, this is not the treatment, sorry. So the treatment of PCOS is just a breakdown. You can give them oral contraceptive. And another thing you need to remember for the exam, when you think about the medication, you think about what is used for, because that is the reason they ask it in the exam. So for example, the oral contraceptive, so this is the same with the slide. Okay, this is more clear. So the oral contraceptive they give them, why do they give them the oral contraceptive? Because it will help to regulate their period, or you can say to regulate menstrual cycle. So because somebody will say they're already having problem with menstruation. So why are we giving them something? And why are we giving them oral contraceptive when we know that oral contraceptive makes you not to conceive? When it comes to PCOS, the oral contraceptive, it helps to regulate their period. Please remember that oral contraceptive. Okay. Then the next medication you can give them is metformin. Why do we give them metformin? They have a lot of insulin resistance. So they have insulin resistance. So it's going to help to lower their insulin level, and it may help to restore ovulation in insulin resistant patients. So another medication they give them is clomiphene, but the most high yield one is metformin, is in the exam. Oral contraceptive to help to regulate their period. Then clomiphene is used to induce ovulation, very important. Then spironolactone. Spironolactone is a blood pressure medication. So it can use to maintain their blood pressure. Like if they ask you what medication can you give them to maintain their blood pressure, spironolactone. And also spironolactone is used to reduce those androgen effects. So those hirsutism and those acne, it helps to reduce it. And another diabetic medication is your proglitazone. So proglitazone is the same as giving them metformin because they are the ones that help with the insulin. Then, of course, we have gonadotrophin. So the ones that I highlighted are the most common one you can see in the exam. Spironolactone, metformin, oral contraceptive, and it's very important. And also lifestyle is very important. Lifestyle, they can give them the combined or oral contraceptive to help to regulate their period and decrease androgen. Metformin is for insulin resistant. Spironolactone is for hirsutism, and they can give them letra- letrozole. Letrozole is for fertility. This one, letrozole for fertility. So as alternate ovulation induction. So that is it for your PCOS. We talked about the medication. We talked about the hormones you need to look at. We also talked about what is PCOS. And we say that PCOS is a common endocrine disorder in reproductive age women characterized by hyperandrogenism, ovulatory dysfunction. So they have problem with their ovulation. They also have problem with insulin resistance.